The first U.S. coronavirus death reported in Washington state. California braces for the virus spread. Everyone probably shouldn't panic. You shouldn't panic. This is not a big deal. Right now. Moving right along, a Washington state man has become the first person in the U.S. who died from the coronavirus. State and federal officials confirmed Saturday the individual was not one of the 2 coronavirus patients the state had already previously announced. The King County patient, who was in his 50s, had underlying health conditions. Let's talk about this for a second. Had underlying health conditions. What does that mean? Well, the virus didn't necessarily kill him. It was a combination of all them combined. I think what even Donald Trump was saying was that if you're healthy, you should be okay, but that's not always the case. That's just normal thinking here. You see, usually the common cold or the common, basically, let's call it the flu, will kill you if you have underlying health conditions such as pneumonia, HIV, other sorts of immune compromising diseases, which might take you out. And this what happens. It says he is believed to have contracted the virus from community spread, not travel, officials said. He died at Evergreen Health Medical Center in the Seattle suburb of Kirkland. Quoting from Jay Inslee, a Democrat, it is a sad day in our state as we learn that Washingtonian has died from COVID-19. Our hearts go to his family and friends. We look to work forward to a day where no one dies from this virus. Number 1 in the country, this guy. Unfortunately. Washington officials also announced 2 coronavirus patients associated with skilled nursing facility in the same community. Life Care Center of Kirkland. One of the patients is a woman in her 70s who lives at the facility. She was in serious condition at Evergreen Health. The other woman is in her 40s who works at the facility and in satisfactory condition at Overlake Medical Center. Wow. About 2,708 residents of the facility and 25 of the 180 staffers have symptoms of virus. Jeffrey Duchin, health officer of public Seattle King County, said Saturday to tell briefing that the Centers of Disease Control and Prevention were very concerned about the outbreak in a setting where there are many older people. That's true, because like I said, older people have a lower immune response to such as COVID-19 or coronavirus. Governor declared a state of emergency. Our priority is now to slow the spread of the virus. Good luck. Wait till spring. Our health professionals say the easiest way to do is to practice good hygiene. Of course, wash your hands. Stay away from coughing people. Sanitize frequency. Stay at home when you're sick. Preventing future cases will require all those to work. Speaking at a news conference Saturday, President Trump described the man who died as a medically high-risk patient, which he was. He emphasized that there is no reason to panic. This is true. You shouldn't panic. And the risk of the general health public remains low. At the same time, he announced new restrictions on travelers from Iran, as well as additional screenings of people coming from Italy and South Korea, where there has been jumping infections. He discouraged people from traveling to these countries at this time. Dr. Anthony Fauci, the director of the National Institute of Allergies and Infectious Diseases, who appeared alongside Trump, also said it was important for people to limit travel to the most affected countries, which makes great common sense. He sought to reassure the public that the government is marshaling all available resources to combat the spread of the virus in the U.S. I actually believe that. I actually believe it. I know. I thought you said you don't believe the government. Well, in this case, I do. They don't want the economy to take even more of a hit. The country as a whole remains at a low risk, but this is an evolving situation, he said. There will be additional cases that we should not be surprised by that. The challenge is now how we deal with it. The newest diagnosis bring the total number of U.S. coronavirus cases to 69, with 47 of them among travelers who were either evacuated from the Diamond Princess cruise ship or on a government chartered flights from Wuhan, China, the epicenter of the outbreak. With new coronavirus cases reported in California, Washington, and Oregon, officials are trying to accelerate testing to stem what experts and officials believe is the inevitable spread of the virus into communities. Man, We are still early in this investigation in California, Oregon, Washington. However, this preliminary information raises our level to a concern about the immediate threat of COVID-19 for certain communities in the United States. If you live in a old folks' home, I'd kind of watch out. Still, officials said that most people who contract COVID-19 experience only mild illness, and the virus is usually severe only in people who are older or who have underlying health problems like cardiac or respiratory conditions or diabetes. There you go. The California Department of Public Health announced 8 testing labs that can handle coronavirus: LA, Orange, Ventura, San Diego, Contra Costa, Alameda, Santa Clara, and Tulare. Officials also announced the arrival of 1,200 testing kits from the federal government. Let's go down to the Food and Drug Administration. Also announced new policies aimed at helping hospitals speed up testing of potential virus. The move comes amid complaints about how slow pace of processing tests. In Seattle, Duchin said the public health officials learned that the man who died had been diagnosed with the coronavirus after he reported as a presumptive positive by the Washington Public Health Laboratories. Laboratories only recently acquired coronavirus test kits, and man did not become eligible for testing until the CDC updated its guidelines to include those who have no recent history of overseas travel or exposure to another coronavirus patient. If we had the ability to test earlier, I'm sure we would have identified patients earlier in the community. I don't think that would have helped them, but who knows? California has 2 coronavirus patients. Let's see. Definitely we have more cases here. You shed virus before you're symptomatic. So it's already out of the bag in a lot of ways. It's true. It's going to spread. It's just going to spread. Yeah, it is. That's why panicking in this situation is not a good idea. Obviously, like I've said in the past in my videos about the coronavirus, is pick up at least a month's worth of food or something. You know, some stuff that lasts long on shelf stable, like tuna, peanut butter. What else? Rice, beans, canned food. You know. Because there may come a time to where you go to the store and they don't have all this stuff. Then what do? You panic, but you really shouldn't. This time back confirms officials because it could have allowed her to infect others that came in contact. That's talking about the woman of Vacaville. Sacramento health officials had said dozens of people might be quarantined at home as a result. UC Davis spokesman Steve Teliano disputed reports that the number could be higher than 70, but refused to say if more or fewer people were quarantined. Coming down to this one, 3 UC Davis students were under 14-day isolation as one awaits test results after showing mild coronavirus symptoms. California's newest patient in Santa Clara County had no known exposure to the virus through travel or close contact with known infected person. Health officials said the individual is an older woman with chronic health conditions, who was hospitalized for respiratory illness, officials said on a news conference Friday. Her physician contacted health officials this week to discuss the case and request testing for the coronavirus. So, in Washington, in addition to the patient who died, a Snohomish County high school student tested positive after seeking care at a Seattle Children's Health North Clinic on February 24th. Officials also announced that another King County woman in her 50s who traveled to South Korea had contacted the virus. Both new Washington patients and the Santa Clara County women tested positive for the virus in laboratories in their respective states. They are considered presumptive positive cases until the results are confirmed by CDC testing. And this news article from the AP pretty much reiterates what the LA Times said. It said that USC Davis Medical Center in California, at least 124 registered nurses and other healthcare workers were sent home for self-quarantine after a Solano woman contracted the virus. They didn't say that in the other report. And continuing on, a number of coronavirus cases from unknown source growing in U.S. The unknown source, that's kind of a funny thing. Like I said, or what we see in the evidence here saying that the virus stays in the body up to 24 days possibly, and then infects the triggers an immune response and gets a person sick. So who knows if a person may have lied, said they've traveled to Italy, in around those areas that are infected, came back to the States before those Italy sources popped up and then started infecting people. You just don't know. That's where we're at right now. So again, don't panic. I know most of you guys aren't out there, which is good. I'm not panicking yet. If I get it, then I panic. But then again, that's not really going to help anything. But again, like I said, just keep monitoring the news, see what CDC has to say. I know you shouldn't trust your government, but in this case, we should probably listen on what they have to say and to make sure that making sure that they're telling us the information. If they say, "Oh, we can't tell you that," then that's when you need to start growing concerned, not panicked.